You know, there are very few things more stressful for a parent than a child who's in pain, especially when it happens in the middle of the night. That sharp cry, the frantic ear tugging, it's a scene we all know and dread. But what's actually going on in there, and what's the best thing to do? Well, let's get to the bottom of it. We're going to walk through the latest clinical advice to figure out what's really happening and how you can help.
Right? It's that moment pretty much every parent faces. Your child wakes up screaming, pointing at their ear. And your first instinct might be to think, we need antibiotics now. But is that actually the right move? In this explainer, we're going to walk you through the modern approach to handling this really common problem. So, first things first, what is actually happening inside that tiny ear? Because understanding the why behind the pain is absolutely the key to knowing the right what to do next.
That classic ear infection, it has a medical name, Acute Otitis Media, or AOM. It just means an infection in that tiny space right behind the eardrum. But here's the part that changes everything. Notice it says it's often caused by a virus. I want you to hold on to that thought, because it's pretty much the most important clue in this whole story.
And if this all feels a little too familiar, trust me, you are not alone. The peak age for a kid's first ear infection is right between 6 and 18 months. It's almost a rite of passage. And that's because the tiny tubes that drain their ears, they're called the eustachian tubes, are just flatter and shorter than an adult's, which makes it way easier for fluid to get trapped back there. So you might think spotting an ear infection is simple. The child's in pain, the ear looks red, case closed, right? Well, it turns out a proper diagnosis is a lot more specific than that. What a parent sees at home isn't always the full picture. When a health professional checks out your child, they follow a really clear process. They'll ask you about the history of the symptoms, they'll do a very careful examination of the ear, and only then will they develop a plan. It's a systematic approach, and it's designed to get the right diagnosis. And this flowchart here, yeah, it looks complicated, but it really just shows how methodical that first step is. You can see it all starts on the left with patient history and assessment. A professional is looking for specific red flag signs. You can see those in that yellow box. And they're ruling out more serious issues before they even think about a treatment plan. It's all about gathering evidence, not just reacting to a symptom.
So this is a really crucial point. There's a big difference between what we see and what a professional needs to see. On the left, those are the symptoms you see at home. The pain, the fever, that classic ear tugging. But on the right are the clinical signs a health professional is looking for with their otoscope, that little tool with the light. They're looking for physical evidence, like a bulging eardrum. Without those specific signs, it can't actually be diagnosed as AOM.
Okay, this right here brings us to the heart of the matter. For decades, the go-to response for an earache has been a prescription for antibiotics. But the science and the guidelines have actually shifted a lot. This is the question on every parent's mind. The pain is real, your child is miserable, and you just want to do something to fix it. So, do you need that prescription? And here it is, the single most important takeaway. For the vast majority of simple ear infections, the answer is no. Antibiotics are not the solution, and in many cases, prescribing them is actually the wrong move.
This quote from the clinical guidelines pretty much says it all. The #1 first-line treatment is just pain relief, things like ibuprofen or acetaminophen. The main goal is to make the child comfortable because, remember that clue from earlier, most of these infections are viral and antibiotics do absolutely nothing for viruses. Overusing them just contributes to the massive global problem of antibiotic resistance. So when are antibiotics the right call? Well, only in very specific situations. If there's actual discharge coming from the ear, if things aren't getting better after 2 full days of solid pain management, if the child has other health risks, or if the infections are just happening over and over again. These are the exceptions, not the rule. Now, while watchful waiting and pain relief is the standard approach, it is absolutely vital to know when a situation is more serious. So let's cover the red flags that mean you need to seek professional help right away.
These are the signs that mean you need to see a doctor immediately. We're talking about severe, worsening pain, any kind of recent head trauma, signs of a widespread infection like a non-fading rash, or more alarming symptoms like facial weakness or major swelling behind the ear. With these, you don't hesitate.
Now, these next signs aren't necessarily an emergency, but they definitely warrant a visit to a healthcare provider. If you see discharge, if the pain just isn't getting better after that 48-hour mark, or if ear infections are becoming a chronic problem, it's time to get a professional opinion. Sometimes the pressure from an infection can cause a small tear or what's called a perforation in the eardrum. This often leads to that discharge we just talked about, and surprisingly, can even bring a relief of pain. And as you can see from the illustration here, if that perforation is medium to large, it's a clear signal that a professional needs to take a look to make sure it heals properly.
So you've managed the pain and you've ruled out any red flags. What does the path to recovery look like, and how can you help prevent the next one? Let's finish up with some practical advice.
Recovery usually follows a pretty typical timeline. You should see improvement within the first couple of days, with pain and fever totally gone within a week. But what's really interesting is that fluid can actually stay behind the eardrum for weeks or even months, which is why follow-up appointments are often recommended, just to make sure everything is cleared up for good.
And finally, there are things you can do to lower the risk of future infections. Keeping routine vaccinations up to date is huge, as is avoiding exposure to cigarette smoke. Simple hygiene helps. And please, never ever put cotton buds inside the ear canal. They can cause trauma and just push wax further in.
So, as we wrap up, it leaves us with a bigger question. A simple childhood earache feels like such a small personal thing. But by understanding it better and using pain relief first, we're not just helping our own child recover, we're also playing a small but really crucial part in the global effort to keep antibiotics working for everyone for when they're truly needed. And that makes handling one sleepless night feel a whole lot more meaningful.